we are facing a tremendous problem in healthcare, and I would love to say that we are facing a tremendous challenge, and I think it can be solved.
I think it's very important that we think about how to use games in healthcare. In 2030, about 25% of Dutch population has to work in healthcare in order to fulfill the demand. That's not going to happen. No. So we really
25%?
Actually 25%, yeah, that's the latest study. So you really need innovative ideas in order to be able to deal with all the things that are going to happen. Yeah, we are having more older people than younger people. Younger people are becoming less of them, so there's less younger people that can work and take care of the older people. So we have to think of games or apps or all kinds of, and on the other hand, all the technology is changing very fast, so we can use that maybe to do something about all the problems we have.
So, we all know that the health is getting more expensive and more expensive in the future. Games are a great way, for example, to reduce costs because many people can play and you only have to build the game once. Also, it can be used in kind of not self-medication, but self-management of people. Because, of course, it's better to stay fit than do something when you get sick.
We talk a lot these days about what's called the triple aim. We've got to improve healthcare quality. We have to open more access to more people. Oh, and by the way, we have to do all that at lower cost.
Yeah.
Well, the only way you can do that is to start doing what we say new with less. So how do we do new things in healthcare with less money? And this is one way, is to use these consumer technologies and phones and things that everybody's got and everybody's using, and think of ways of how they play out in health and healthcare.
So is it mainly the costs that are important, or is it also the people?
I think a cost is certainly important. I mean, around and anywhere I travel in the developed world, whether we're spending 10 or 12% of GDP, or like we do in the US, 18% of GDP. Governments and citizens are very concerned about the spiraling costs, and eventually you're going to hit a wall where that cannot continue.
No.
So we've got to get smarter about how we sort of provision healthcare services and how we provision them, and even by whom. So the whole role of clinicians and the way we use nurses and other kinds of clinicians in healthcare is important.
For me, games are similar into seducing people. And the biggest problem in health, so not in healthcare, is trying to seduce people into a better lifestyle, stop smoking, start moving actually. And so you need, like BJ Fogg tells us every time again, you need baby steps. And once serious or applied games, what some people like to call it, come into the position, it's a possibility and it's a chance actually. So we should try to engage on that on a very high level.
Because what we've seen in the past is that information doesn't work, right? You have a pack of cigarettes and it says smoking kills, and the person's still smoking. And we have doctors who tell patients they need to eat better, they need to exercise more, they need to take their medications every day, and they're not doing it. So we have a problem with the behaviors. And we also have this point where you used to go in the hospital and the doctor treated you, and now you have to maintain your health outside the hospital. And there needs to be some kind of pervasive influence that's not negative, telling you what you're doing wrong, but it's rewarding you for the positive behaviors.
But why should a game, why should a game work when a doctor doesn't, or when a doctor tells you to behave yourself, you don't do it? Why should you do it when a game?
Well, doctors aren't really trained in behavior management, right? They're trained to be doctors. They administer medications, and so when you make a game, you work with someone like a psychologist or an educational specialist who's trained in helping to motivate you to change your behavior. So you're working with a behavior specialist inside the game.
But I also think is that people are changing, and the digital natives of this time are more susceptible to these kinds of stimulations, and I think and people demand higher quality, and I think games can help to achieve that.
Because the healthcare is moving so much, there's a lot of openness for change. So that's why it's also an interesting market.
So it is a time of great opportunities.
Yeah, I think so.
Yeah?
Yeah, and great possibilities. There's so much to be done. You can help professionals, you can help patients. Most of the things in healthcare deal with change of behavior. I think games are brilliant in giving people insight and let them experiment and play with change of behavior and motivate them to change their behavior. So it's a field that combines quite well, games and health.
Are there doctors already who are prescribing games?
Yes.
Yes?
Yes,
Yeah.
and even in the United States, 2 games are submitted by the FDA, the Food and Drug Administration, and granted as a medicine. So there are medicines on the market in form of a game, and they work better than the prescribed drugs against, for example, schizophrenia and ADHD.
Games might be our only chance to make healthcare possible in the future, still possible, because there are just too many elderly people, and we just cannot afford to continue doing it like we do it right now. For instance, if you have elderly people who trip and they break bones easily. So with games we can help them, we can train them to have a better balance. And now training is a bore. It's really boring, and they don't want to do it. If you turn it into a game, they actually like to do it. They participate in far bigger numbers, so they trip less, so they break less bones, so they effectively cost less in the future. So it's a very important tool to keep healthcare affordable for our society.